If you're a nurse in Australia, you know that some responsibilities are way more than just part of the job. They're a fundamental legal and ethical duty. Today we're diving into one of the most critical of them all, your role as a mandatory reporter in protecting children.
Just take a second and think about everything your job entails. All the clinical skills, the patient care, the charting. With all of that, what do you think is your single most critical legal duty? The answer really gets to the heart of protecting our most vulnerable patients.
And that duty? It's your obligation as a mandatory reporter. This isn't just about ticking a box or following a procedure. It's a really profound legal and ethical responsibility that is absolutely central to your role as a trusted healthcare professional.
So what does that actually mean in practice? Well, mandatory reporting is a legal requirement, and I really want to stress that word legal. It means the law compels you to report any reasonable suspicion that a child is at risk of significant harm. It kind of expands your role from just a caregiver to a protector.
And the law is pretty specific about what counts as harm. It's a really wide spectrum, you know? It covers the obvious things like physical and sexual abuse, but also those often less visible signs of neglect, emotional harm, and even exposure to family violence. This gives you a clear framework to guide your observations. Okay, so we know what needs to be reported. The next big question is, who exactly carries this responsibility? Does this apply to every single nurse? It is so important you know exactly where you stand on this.
And this is where the distinction is really clear. If you're a registered nurse, the answer's simple. You are a mandatory reporter in every single Australian state and territory. That legal duty rests directly on your shoulders. For enrolled nurses, you're also mandatory reporters in most places. But here's the key part. Even where you're not explicitly named in the law, you still have an absolutely critical duty to identify, document, and escalate to your RN immediately. You are the eyes and ears on the ground.
So this brings us to what is often the trickiest part of this whole thing, knowing exactly when to make that call. What's the trigger? You know, what's the actual threshold you need to meet before taking that massive step? Now listen up, because this is probably the single most important takeaway from this entire explainer. You are not a detective. You do not need to prove anything. Your role isn't to investigate. It's simply to report a reasonable concern. The legal standard you have to meet is what's called reasonable grounds. It sounds like legal jargon, right? But it's not about being 100% certain. It's about forming a reasonable belief or a reasonable suspicion based on what you see, what you hear, and your professional judgment. The whole system is designed to trust your clinical expertise. And here are some real-world examples of what reasonable grounds might actually look like. It could be something as direct as a child telling you they feel unsafe. Or maybe it's a pattern of unexplained injuries. It could be seeing a caregiver's behavior, like being intoxicated, or just clear signs of neglect. These are your red flags.
Now, it's super important to remember that while the main idea of reasonable grounds is pretty consistent, the little details can change depending on where you are. Things like the exact age of a child or the specific wording of the law can differ from state to state. The big takeaway here is simple. You have to be aware of the specific laws right where you practice.
All right, so we've covered the what, the who, and the when. Now let's get practical. How do you actually make a report safely and effectively? What's the process? The good news is, the process is pretty straightforward and logical. You don't have to wing it. First, you identify the signs. Then, you document everything objectively. You immediately escalate to your supervisor, and then that formal contact with the authorities is made, usually by an RN or a manager. Following these steps protects you, and most importantly, it protects the child. Let's just double-click on that documentation step for a second, because it is so vital. Your notes have to be objective. We're talking facts, what you saw, what you measured, and, this is critical, what the child said in their exact words. Your notes are not the place for your own assumptions or interpretations. They need to be the factual foundation for the entire report. And we can't talk about how to report without talking about cultural safety. This is absolutely non-negotiable, especially when you're working with Aboriginal and Torres Strait Islander communities. It means you've got to actively avoid stereotypes, work respectfully with families, and get Aboriginal health workers involved whenever you possibly can. Understanding how historical trauma can affect trust, well, it's not just a nice to have, it's fundamental to making sure your report is both effective and ethical. Okay, let's bring this all together and get to the bottom line. At the end of the day, it all comes down to a simple choice, but one with massive consequences. The choice between taking action and doing nothing. If you only remember one thing from all of this, let it be this: when in doubt, report. The system is literally designed for you to err on the side of caution.
Your job is to raise the concern. It's the Child Protection Authority's job to investigate it and make the final call.
And look, the consequences for failing to report are severe. We're not just talking about legal penalties or professional misconduct hearings for you personally. The true devastating consequence is the continued unchecked harm to a child who is counting on you to be their voice.
So I'll leave you with this question to really think about in your own practice. When you consider your duty of care, your legal obligations, and your unique power to protect, what is the true cost of silence?